Hello and welcome to today's webinar, Winning Strategies to Attract and Retain Employer Group Customers. Before we get started, I'd like to review a few housekeeping details. Today's webinar is being recorded and an online archive of today's event will be available within 1 to 2 business days. If you have trouble seeing the slides at any time during the presentation, please press F5 to refresh your screen on a PC or Command R if you're using a Mac. You may ask a question at any time during the presentation by typing your question into the Q&A box located on the right side of your screen and pressing enter. And finally, I'd like to remind you of AHIP's antitrust statement located in the link just below the slide viewer. We will, as always, comply with that statement. Among other things, the antitrust statement prohibits us from discussing competitively sensitive information. And we're very fortunate to have with us today Kevin Ruane, practice leader in the analytics advisory practice, and Renee Wizarek, a principal product manager, both with Truven by Merative. And at this time, I'd like to turn the floor over to the speakers.
Great, thanks so much. Again, I'm Kevin Ruane. I lead our analytic advisory practice. So I just wanted to start to just give a little bit of background on Truven. I'm sure you're all familiar, but we are a analytic and consultative software group that we work with clients day to day on analytics around value-based care, provider profiling, account group reporting, program evaluation. So our flagship product is our Health Insights, which is an end-to-end enterprise solution. Under that, we have Account Group Insights, which we'll be talking about that need today and the need for payers to differentiate themselves. We also have Flexible Analytics, which is a freestanding analytic engine for clients who want to embed analytic models within their solution. And also just a bit about Market Scan, because we will be talking about benchmarks and the need for benchmarks with account group reporting. That is our de-identified benchmarking and research data set. So we have over 300 million lives in that data set going back over time. So it's a strong data set for research, but also for benchmarking. When we're talking about account group reporting, we want to be able to show employers how they're doing, right? We're going to show their trend, but I want to see how they're doing according to the U.S., according to the state, according to the industry. So I want to be able to have all those cuts. We work across the healthcare ecosystem, obviously payers. We work with employers, health systems, state agencies, and public entities. We have 7 of the top 10 U.S. payers and 40% of the Fortune 100 employers. So a lot of opportunity here, and we're funneling that back into our products and our insights, and happy to talk with you today about that. And we're proud of the retention that we've had with our clients and our long-standing relationships. I did just want to talk about Springbuck really quick because it's really exciting news, and it's been in the news. It was just announced 2 weeks ago that we have acquired Springbuck. So there's a lot of synergies there. Together, we we can meet a wider range of employer needs. Springbuck brings over 7,500 small and mid-sized employers to our book of business. So there's a lot of synergies here. We're going to leverage the combined technology, work across both platforms. So Springbuck has been doing great work, more to come there for sure, but the synergy is fantastic and it opens up new opportunities for us. So a big welcome to them. And again, this is just hot off the presses, so it's just 2 weeks old. So very exciting for us though. I want to do a quick poll first just to understand how currently you're reporting on performance on account groups, right? Just to understand for the audience, whether or not you've built your own solution, and we have a poll here that will ask just a series of questions just to say where you're at right now. For the moderator, do we want to do the poll?
And the poll's running on your screens now. How are you currently reporting on the performance of your account groups? We built our own solution. We licensed the solution. We have a hybrid of licensed and custom solutions. We don't have a way to report on account groups, or I don't know. We'll leave that running for a few seconds. Thanks for your participation.
We'll just see the results just from the group, just to kind of see where everyone's at today. So it'll just take a few seconds for everyone to fill that out, and then we'll see the results.
Our results are in.
Okay, so we built our own solution 33%. We licensed the solution, we have 0. We have a hybrid solution of 42%. We don't know a way to report on account group, 0%, and I don't know is 25%. Okay, so good to know. We're going to be talking through the different options here and the different considerations as we talk through it. So for today, what we're covering here is, different considerations when you're looking at account group reporting, right? And looking at your roadmap, whether you're just jumping into it and starting with new reporting, whether you are homegrown and you're looking for different options, hybrid, a lot of things to discuss. So we're going to talk through build, buy, or both. There's a lot of considerations when you're looking to do that. Data accuracy and integrity, which I know is foundational and paramount, and I'm sure no surprise to anyone on this phone, but so important to get that accuracy and integrity correct. We lose credibility not getting the foundation right. So the foundation is key here. We're going to talk through that. Integrating disparate data sources. So there's an explosion of data types, right? Way back when, we wanted to make sure that we had the medical claims, pharmacy claims, provider file, enrollment. There are many, many data types that really bring in new insights, but you want to be able to pull them in. And it's a way to differentiate yourself with your employer clients. Your employer clients are looking, and your brokers are looking for more data sources to be integrated. You want to make sure that's on your roadmap and on your capabilities. Analytics and advanced analytics and consultative wrap. So the analytics themselves as part of the infrastructure, what key KPIs are we surfacing, what insights are we surfacing, so making sure the advanced analytics are there. And then freeing your staff up to have that consultative wrap, right? If we put the account group reporting in place and we are surfacing the insights, our clients, your clients, our clients are looking for that consultative partner, right? And we want to be able to rise to that by automating and have a consultative wrap based on the KPIs and everything we're servicing. Then automated, scalable, and configurable. Renee, again, as a principal product manager, she's going to be kind of really going in from that customer experience perspective after we go through the foundation. So where do we want to be? The starting point is going to vary by clients, right? The lack of confidence in data integrity, that's going to vary across clients, lack of account-specific data analytics, but it is something we hear quite a bit in the market. We see it in RFPs. So we want to be able to get to the point where we have an accurate high-end, back-end data model, right? Again, having that data as foundation and the flexibility of the data model is going to take us to the next level. We want it scalable and account-specific data and analytics. One size fits all does not work for account groups. I know everyone on the phone knows this, right? We have insured versus self-insured, small groups, mid-sized group, large groups. We don't want to send a ton of data to a very small group. They would get lost in it. There would be misinformation in it. The small groups maybe just want a 3 or 4 page PDF, but the large groups want an interactive experience and diving into that, right? So we need to be able to have that account specific to say who is their persona and what information do they need. And there is a situation where there's too much data, right? And we want to be able to not push out the data to the wrong people. It's specific to the end user. What should they see? What are their KPIs? What are they trying to accomplish? We really want that account specific. Proactive, configurable, and dynamic reporting, automated and easy to use, and then again, that strategic healthcare advisor to employer partners. So that destination is really kind of universal, and that starting point is really going to vary based on where you're at in your journey and also your role specific within your organization. So build, buy, or both considerations, and we got different answers across the board of building your own solution, licensing versus hybrid. So build is control and customization, right? So that is, if you're building a custom solution, obviously you're in charge of the roadmap, you're in charge of the technology. So from that control perspective, if you need a very, very customized solution and the market is not meeting your needs because of that, then build is an option. As we're talking about licensed solutions, well, there's a lot of customization out there, but again, the control is as people look to build their own solutions, control and customization is something they consider. It's costly, it's resource intensive, and it can be slow, right? Putting together the staff in order to create that. So whereas a software vendor and a IT partner is building across clients. When we're building our own, we're building it for ourselves. So that can be really resource intensive. Takes time to build that out, and the functionality where a mature solution has been getting feedback from the market, iterating on it, so you can have the situation where it is slow. There's also the opportunity cost. So as people are assessing what their, what path they're going on, so there's the cost of getting all this together and putting together not only your IT resources, but then your data science resources. Where am I getting the analytics from? The report configuration, the BI level. What am I creating all these reports? And I'm not starting with templates. I'm actually creating, right? Creating all of that takes a lot of time, but it's also the opportunity cost. So for example, if I were talking to an account executive and they are busy building out templates and wrangling reports, I know as I talk to clients, they don't have a huge amount of staff to say we can redeploy people here, right? We want the account executive to be serving up insights. We want the self-service to say, okay, well, 90% of the reports that we think are here, we can tweak them, we can push them out, and then I'm freeing my account executive to consult, right, and meet with the account, show the reports that we've created, tweak the ones, and then create the custom ones they want to. Data science as well. From an analytic perspective and all the different models, do we want our data science team creating foundational analytic models, risk scores, episode groupers, what have you, or do we want to surface those and then our data science team can build on that as well? So we want to be able to look at the cost of doing this and maintaining it and the security of it. Again, it's not a small feat, but then also the opportunity cost, right? If we put something together in place that's off the shelf, and again, looking at the control and customization as part of it, where can I redeploy the staff for higher level? I want my account executives to be consulting and not spending the time wrangling and publishing reports. So that gets us to buy, right, that speed and reliability, but it can offer less customization. So that's where you want to talk to the vendors as you're talking to vendors who are in the account group reporting solutions, and asking them about the customization, because, and then Renee will talk about this a bit as well. One size does not fit all, right? We actually have all these different views of that small account, insured versus self-insured, what KPIs, what data source do they have. You need to be able to customize the solution. So when you're looking to buy, although building your own, obviously you have all the customization you want because you're in control, working with the vendor to understand their customization, their configurability to make sure that we're meeting the end customer's needs. And then when we buy, the vendor is taking on overall the maintenance. They have the security and all the protocols in place. They have the data management in place. So again, it offers you the ability to free up your staff in order to consult, innovate with data science, work on other IT projects. So that's consideration. One thing is just to look at the customization, and again, you have full control when you're building, but talking to the vendors about the customization that's out there. Because again, they're getting feedback from the market to say, well, here's a nuance of this account, and this is what I need to show. So you're funneling that back into the solution, right? So although there's less customization on, not building your own, there's quite a bit of customization out there. So you want to be able to look at that. There's also a hybrid approach, and I know we got some answers on hybrid as well. So this is where and I just have an example here, this to take all different flavors, right? But when we're putting together account group reporting, it's all the infrastructure and the dissemination and how am I bursting reports out to the end users and the PowerPoints and annotating the reports and the KPIs. But there's also the models themselves, right? What insights am I surfacing? I need a clinical grouper. I need benchmarks. I need case mix adjustment. I want my HEDIS measures. I want my pharmacy quality alliance measures. So here's an example of a hybrid approach, is to say, I actually do have my infrastructure in place and I want to leverage that, but I want to, again, I don't want to deploy my staff to create all the stuff that exists in the market and is known in the market, right? So an example of a hybrid approach is licensing those analytic models to bring into your own infrastructure. And then your team is in charge of the infrastructure and the bursting of reports and all the configuration there, but it's surfacing insights that already exist. So again, data integrity is foundational, and I don't think that is probably news to anyone on the phone. It is key to getting a trustworthy insight, right? I see it in RFPs all the time, and as I'm talking to clients who are moving from other vendors, is they couldn't get my data right. That is paramount to what we're doing. If I have a very great-looking tool that has a slick interface and best-in-class visualization and dashboards, but it is sitting on bad data, I actually have bad analytics, right? And as we lose our credibility with the account, it is hard to get that back. So making sure that we actually have the data cleansing and infrastructure in place is paramount to that. And as you're talking to different vendors, you want to talk to them about the number of files they're taking in, example, and the number of vendors they're working in, they're taking in. So for example, we work with over 450 vendors that are sending us data files every month. We take in over 25,000 data files a month. You want to vet that as part of the process, right? The people you're working with need to be working with vast amounts of data. And once they have that, to say that we have all this data in-house, what is their testing process? We want to make sure this data is clean and reliable even before we build the analytics on top of it, right? So it's not just, is this field populated, and is it populated with a valid code? So for example, how often should a room and board revenue code be on a facility claim? I want to test for that, right? So that the claims can come in looking great, but it doesn't pass the sniff test for this is how, what we expect to see in the market. How often is diagnosis code 2, 3, 4, 5, right? All that's going to impact your analytics, and how often are those populated? So I want those tests on my data to make sure that the data coming in is clean, again, because down the road, if we lose the credibility from day one, it is really, really hard to get back, and we hear about that all the time. The other thing I would say when we're talking about, and again, this is also for those who have built their own, the tests you would have in place is not just testing the incoming data, but it's the analytics themselves, right? There's sometimes we don't see the nuances of the claim. It looks good, and then we build an episode of care, or we built a HEDIS measure, or we are aligning service categories, we built a DRG. I want to be able to trend those analytics, because those are the analytics and the insights that I'm serving up. So not from a testing perspective, and to make sure we're getting it right, I want very thorough incoming testing, and then also from the trending and analytics themselves, and you can be able to catch additional nuances. Again, it's probably not the most interesting piece of this, but if we don't have the data right, it impacts everything down the road, and it's really hard to reclaim that credibility once you lose it. The other thing I want to mention is just ingesting diverse data types. So we are for sure, having our bread and butter files, right? We have to have medical, and we have to have pharmacy, and we have provider, and we have eligibility. But there is really an explosion of data types out there. Again, I'm sure not news to any of you. And our employer clients and our brokers are demanding more. And this is a way to differentiate yourself, to say, as we're in a competitive bid process and things are looking, very similar with network discounts and network leakage and things like that, being able to pull in new insights and be able to say that I can take in all these data sources. So health equity, obviously a big need, and all clients are looking at the health equity perspective. A point solution. So point solution evaluation is huge, right? And all these different point solutions, and our clients are looking to do an evaluation on point solutions. And is this working? It's not working. I want to fail fast. If this is not something that's helping my members and employees, and it's not something that is driving value, I want to move on to something that will drive value. So having all those point solution as part of that. It's even interesting too, like as we're working, I mentioned that we work with many, many employer clients as well, in addition to directly with health plans. And we're consulting with them. They're bringing in a lot of different data sources. We bring in over 50 different data types. When you're talking to a vendor about account group reporting or even enterprise analytics, being able to take in these new data sources, and some aren't so new anymore, but there's data sources that are probably coming out right now that will be commonplace in a few years, right? So we want to be able to do that. So an example is working with an employer client who wanted to look at financial health for their employees, and how does the financial health of employees impact their physical health, and are they getting the care they need? So taking in financial files, in addition to salary indicators and things like that, we can take in files from Fidelity. And what we're looking at was if someone had a 401k loan, or if they're not contributing to their 401k, how does the financial stability actually impact their care and their gaps in care? So a lot of really interesting things you can do by taking in these different data sources. And again, our employer clients are demanding it, but it also opens up not only to feed account group reporting, but there's also opportunities for one-off studies, right? You have a really premier client, they're looking for you to consult. We have these data sources in here. We have our analytics. We can go ahead and do an advanced analytic project for a client and really kind of be that consultative rep. So when we're in a competitive bid situation, being able to say, here's all the 50 data sources I take in today. You can see that we have shelves in place. We have analytics. We've already been running on this for clients. Here's some examples of different ones we've done, whether it's disease management, point solutions, on-site clinic data, sociodemographics, all of that. And then if there's a new data source, again, our data model is flexible enough that we can take it in. So you want to make sure, again, if you're homegrown or you're working with a vendor, that their data model is very flexible. As new data sources come out, that they're able to accommodate, not just the ones today. And again, when you're talking to a very large account that you're trying to land, this can be a differentiator, and it opens up a lot of consulting opportunities for those clients. Then I wanted to talk about analytic models and insights, and then the consultative wrap, right? So this is where what we're surfacing up in our tools. Again, we're talking about pushing reports out to our stakeholders, right? Whether these are our broker accounts, whether these are our small employer accounts, large employer, insured, self-insured. All these insights need to come from analytics, right? And we want to be able to have a solid foundation of analytics as part of the tool. And again, this is when we get back to the build or buy. Do I want to, even if I am building my infrastructure, do I want to recreate all of this that is already out there? So from a predictive model perspective, we want to be able to show the risk of the population and how it's trending over time. We have models that are looking at risk of rising costs. What is the risk of the population to actually be more expensive in the next time period? Risk of hospitalization. So a lot of risk models out there. So the predictive models are key. Also, when you're case mix adjusting, your tool should be able to case mix adjust to look at the risk of the population compared to the benchmark. So the predictive models are going to give you new insights, and we want that as a foundational analytic model that feeds these insights. And our employer groups are very much looking for it and looking for innovations around that. We also have clinical and event groupers, very key to the account group reporting as we look at, we know that chronic conditions are growing at an astronomical rate, comorbid conditions. So we want to be able to look at the clinical conditions in context, right? How many patients do we have that are diabetes? What is the severity of the diabetes? How many patients were admitted for diabetes? So from that clinical and event group, or whether we're looking at the clinical condition for diabetes in itself, or we're looking for perhaps an admission as part of that, we want to build the admission and the outpatient event. The clinical and event groupers are also foundational that we want to build into the tool itself. We have quality rules. This is where we're actually going to be able to show also how well we're doing with our clients. So from a quality rule perspective, HEDIS, PQA, Pharmacy Quality Alliance, choosing wisely measures, we want to be able to show that we are getting the patients the care they need, or when there's opportunity, we can actually show them that, hey, we need to move the needle here, perhaps an outreach, perhaps a care management program, but the quality rules will be part of that. They're foundational to a health plan. When we're looking at our HEDIS and STARS and all the performance metrics, things we're funneling to value-based care. But our employer groups care as well, right? They need to see that quality care is happening, and when quality care is not happening and there are lags there, we want to be able to show our movement as well as that, right? And an action plan. Categorization models, service categories, population classification, all of those. And again, I mentioned benchmarks. Benchmarks will be key to this because I want to show an employer group not only how they're doing trending, they may be trending in a great direction, but But we want to be able to look at the U.S. versus the state versus the MSA to say, well, I live in Ohio, and it's great to look at the U.S., but Ohio is very different. And I am in this MSA, and I'm in the retail industry. Retail is very different, right? I want to be able to look at all those cuts. So I want to be able to consult with the client to say, I can show you how you're doing, I can show you what the trend is, and I can show you how you compare. And again, this is where our market scan is coming in, or whatever benchmark database you have, but benchmarking is for sure expected and needed as part of this. So driving insights. So as we're funneling the reports there, we're creating the reports again. The standards that are there is what happened. We need to report on the past. It's, again, what has been spent, what is the per 1,000 for the conditions, what are the open gaps in care, why does it matter? So showing the KPIs, surfacing those KPIs early to show them why this matters. What is it doing to their trend? What is it doing to their overall health and illness burden? And then what do we do next, right? So this is kind of twofold when we're looking at it. It is, what do we do next? I want to surface that in the account group reporting to say, okay, well, if we worked on our readmission or avoidable admissions, or if I slowed the disease progression for diabetes or COPD, this is a savings opportunity. So I want to be able to surface what we do next so they see that consultative, and it may be an opportunity to put them in a program that you're already selling today. But then the other thing, what do we do next is you want to be able to say, and this is where enterprise analytics is about connecting, right? Although we're not going to share the person IDs with the employer, right? They shouldn't see which of their members have what conditions and what have you. We want to protect that confidentiality, but your care management does, right? So you want that link there to say, I met with my account group. Here are the KPIs. Here's why it matters. Here's what's doing it to your bottom line. I do have these programs. And now I can take immediate action because behind the scenes, everything that built this, I have a person ID list, and I can hand this off to the care manager, or I have a provider ID list to say, hey, let me meet with the network management to show them what's happening with XYZ providers. So that what we'll do next is, again, going to show the credibility, show the actionability. It may involve an upsell opportunity to sell some of your programs, but it also shows that it's not just about reporting in the past and this is what it is, right? We want to take the actionability. We are invested in growing population health. We're invested in cutting costs, and this is how we do it. And then the last piece really is that consultative wrap, all right? So, the goal here is, I can't really consult if I'm wrangling reports all day and this really isn't automated. There is a lot of work that goes into doing all this. And I talked to account managers and account executives at health plans. I was one myself many, many years ago. All of that administration work to pull this all together is extensive, right? And I really want to free my staff up to consult. So this is where the automation and self-service, once I have that in place, and you're never going to answer every question, right? Maybe for your small accounts, right? Hey, they need a 3-page dashboard, 4-page dashboard. Here's the KPIs they're looking for. But for these larger accounts, they're not going to get every single answer. It's not possible. They're going to have questions, but that's where, okay, they've self-serviced 90% of what they were trying to do through the automation and through the dissemination and all the different things we've put in place. But now I can consult, right? If we do it the right way, all that is automated, and now I'm really focusing on that 10% where I can grow my book of business. I can prove myself to my clients. I've already shown them how we're making headway with the KPIs and the reports, but there's more opportunity here. So there's a value add opportunities to say, wellness, disease management, mental health, telehealth, virtual care. What programs do they need? And also, what programs do they not need, right? If there's something that they don't need, we want that credibility to say, hey, you're doing really well here. Here's how you're doing. Here's how you're trending. Here's the benchmark. You're doing fantastic. Let's focus on this program because this is where I see that we could use some work, right? We're seeing a disease progression. We're seeing more per 1,000 for this condition. We are seeing more costs, and we could use some help here. So it really kind of frees you up for that consultative view. Special one-off project or study I just mentioned where we had a large employer client looking for financial help. Super interesting to say, how does that impact? So again, that consulting, as we're talking about the product itself, you want to funnel back. If someone's asking this for the same report over and over, right? GLP-1 back in the day used to be, what's that? It's a new report, right? But we need to funnel it back. If everyone's asking for it, that needs to be a dashboard, right? But there are special one-off studies that will probably never be a dashboard. It's specific to the client's need or specific to their data type, what have you. But again, we automated. Now I have all these different data sources because I brought it in. I can go ahead and do this special one-off study. I could sell new data sources. Again, with data sources come new insights, and again, a differentiator, high performance network, benefit design strategy, etc. So all of that, again, is leading the foundation to differentiate yourself. It's a competitive environment. We want to be able to bring the insights. We want self-service. We want automation. And the goal there would be, once I have that, I can really consult, right? I've freed up my team, and clients are looking for that, right? As we, as Truven as well, right? We want that. We're a strategic partner. We don't just want that vendor relationship. And putting all these things in place is really kind of what is going to free you up to do that. And so I'm going to hand it over to Renee, who's going to kind of talk about it from the customer experience, right? And then all of her, work in product. Renee?
Great, thank you, Kevin. Hi, everyone. Renee Wazorek, and I'm a product manager here at Truven Merative. And my job is to do exactly that, is to understand the market, understand the users, and really develop that customer experience through the products that we release. So I'm going to talk a little bit about, build upon some of the things that Kevin said, as far as the key points that you really want to make sure you have included when you're thinking about your account group reporting or your employer reporting solution. So regardless of how you are implementing that, really focus on these things are things that I need to make sure that we're paying attention to, because they're things that my users are going to need. So with respect to being able to have successful accounts, you really want to make sure that you have, and some of this is building on things that Kevin said, but you want to make sure you have those analytics, right? You have those analytics, but they're on that robust, reliable data model that's designed specifically for the type of reporting that you're doing, making sure that it's accurate, comprehensive, allowing you to empower your users. And that's the key, is to empower your users, both your internal sales executives as well as your external users and customers, to make sure that they are able to make smarter, data-driven decisions across the different areas of their business. You want to make sure that it's scalable, so whether you're reporting to one account or thousands, you really want to make sure that those users, again, regardless of where they're coming in from, can access the data that's most relevant to them to answer those specific questions without impacting the performance, as well as the personalization. You want to make sure that it's flexible enough so that you can do that personalization and configuration for the different types of audiences that you're working with. And reporting in general, obviously, isn't one size fits all, right? You need those tools to adapt to the different types of audiences that you have. So you need to make sure that you can configure the reports to match those different needs. And we'll talk a little bit about this in an upcoming slide. But this again is going to allow you to proactively deliver those insights, making sure that you are, ahead of your team instead of, And again, as Kevin was talking about, it's not just about the reports and what's in the reports. It's really about elevating your role and making sure that you have the right insights so that you can guide your client strategically and not just tactically, right? So it really strengthens those relationships and helps you in the end, and helps your customers succeed and helps you be more successful as well. And then let's see. Let's go to the next slide. So each one of your account groups is different, so really, how are you going to require, and how are you going to, develop the information for that customer experience to tailor it to those types of audiences? So some clients, and customers and users are going to require or want web-based interactive dashboards that let them dive in, ask questions, find their answers, really empower them to explore information, and uncover those answers on their own. But others are going to prefer, or perhaps that's what you want to provide, more curated, downloadable report packages. So these things would deliver very specific account insights that's important to them, and that might be about depending on their client, the size of the account, or it could be based on something else, the industry, something that makes these types of reports that you think that some customers might need both of these things, as far as what type of information you need to provide. And as Kevin was talking earlier as well, it's not just about the clients. I mean, it is about the clients. But your sales team also needs the right tools, the right information so that they can engage the accounts. So you can build those stronger relationships and drive your business forward. So because your sales team is often that first point of contact, when you have the right tools for them, then they can better position your solutions and really strengthen those relationships. And in the end, you're not really just delivering data, you're delivering real value to your customers. Sorry. So we've got, you want to really focus on what matters most, right? So you want to make sure that you're identifying opportunities and patterns. And so again, just to build upon what Kevin was talking about, making sure that the data is going to help you see beyond those individual cases and really uncover those patterns. So with that visibility, you've got the ability to identify more opportunities for intervention and improvement. The real value is going to come from prioritizing, coordinating your actions, so the right resources are applied. That's both on the customer side and on your side as you're trying to help your customers answer your questions. And really, retrospective is not enough. And again, Kevin talked a little bit about this as far as being able to look at things from different models in different ways. Concurrent prospective views are going to really allow you to address issues and anticipate what's coming next. That's going to help your customers and you manage those costs and utilization more effectively. And again, Kevin talked about kind of the risk models, episodes of care, benchmarks. We can't stress that enough. The analytics that you put into the database are going to be so important as far as helping you understand which patients or populations are most vulnerable, being able to predict that future and clinical financial risk for the different populations or for the different accounts. You need to be able to do that as far as understanding that member risk and be able to stratify for some of the things that you need to do behind the scenes to really help, again, guide your clients. And those episodes of care are also super important to really provide that holistic view of cost and quality across really a full treatment journey. And then we talked about benchmarks as well, giving your customers a standard for comparison so that you can really measure that performance and understand where there might need to be improvements. And once you've got that data model and be able to use that intelligence and all those methodologies, that's going to allow you to have meet the different needs for your employers or for your account groups to find new trends or spikes and really be proactive and demonstrate that ability to react and respond. And so I want to talk a little bit about designing the reports for your customers. So for that customer experience, we can't discount the importance of the report set that you provide and the visualization. You really need to make sure that you're able to tell a story with the data. It's really an art and a science. And so, never underestimate the power of how you tell that story. You need to understand your target users. What are their concerns? What are their capabilities? What are their challenges? What are their pain points? And what you need to be able to provide and how you want to provide that to that audience. We've done this a long time here at Truven as far as understanding the types of questions that are answered. And so you want to make sure that that report set is really created in such a way to answer those burning questions. So be able to have consultative analytics, be able to have actionable insights in those reports, but make sure that there is the ability to have quick answers, an intuitive interface, the ability to drill to detail, and that's all going to start with the design of the reports that you provide to your customer, whether you use your vendors out of the box reports, but again, the importance of configurability and customization becomes a key criteria that you want to use if you're using a vendor to really understand so that you can make those changes as necessary to reflect the importance and the information that you need to the different groups. But being able to highlight essential information such as financial trends, drug trends, the clinical mix, the chronic conditions, the quality of care, all of those things you need to make sure, again, backboned by a lot of the analytics that you put into the reports, making sure that those are there and they're in a clear, modern set of graphics that are portable, that can be exported no matter how that information is delivered. Making sure you've got, again, different interactive views so you can filter or, slice the data in such a way by plans, union, non-union, region, All of that will vary based on what you want to provide to your different customers. Smaller customers, you may not need to have, that level of information at all, but, you need to be able to understand and create those types of report packages and report sets for that configuration for those different audiences. You want to make sure that you're able to send data as well to them very easily. And configurability is really important, and as I've been talking about, and so you want to make sure that you can customize the content. Every customer is going to have unique challenges and goals. You need tools that are going to let you tailor the content accordingly. So this customization is going to make sure you stay relevant, because you don't want to necessarily have the same set of reports forever. You want to make sure that you're able to add new reports, modify reports, and really continue to increase the engagement around those reports and increase the impact that they might have on the users. You want to have routine reporting that's automated, so that will, again, save you significant time and effort. I think Kevin touched on that as well, making sure that these things can be run automatically, that you don't have to go in and do something, but at the same time, you want to still have control. Can I review the reports before it goes out? Am I able to add information to the report before I sit down with my client? Making sure that you've got that level of control where you need it, and then not having to choose one way or the other and have to sacrifice certain things for different customers. So this will allow you to balance both efficiency and quality assurance. And again, because customers don't consume data the same way, you really need to, again, choose that best format, whether it's through interactive dashboards, report packages, some sort of summary, making sure that you've got that flexibility to really meet that wide range of your customers' expectations. And again, we talked a little bit about the consultative piece, but when you've got automated reports, while those provide that foundation, your expertise is really what's going to add the most value. So you really want to make sure you've got things that are editable, maybe in PowerPoint, so that you can add context to things when you do those one-on-one and sit-downs with your accounts for those strategic account reviews, and making sure that you have those client conversations that become more meaningful and personalized, without having to recreate and do something totally from scratch every single time you want to sit down with a customer one-on-one. And at the core, it's, again, high quality database. So it's going to combine that standardized data with your unique elements that are really specific to your customers. This is really going to ensure your reporting is both comprehensive and highly relevant. And so I just want to end with kind of a checklist of items. These are the things that you really want to make sure that you've got from a perspective of data quality and management. So this kind of wraps up both what Kevin and I have been talking about with respect to client, employer, or account group reporting. You really want that data to be correctly reflective of the dollars and the care that you're providing for every account. You want to make sure you're able to identify opportunities to reduce costs and improve care quality with drill downs, as well as predictive analytics. You want to have benchmarks, making sure that whether you're using your own internal benchmarks or some external benchmark, you want a way for your accounts to compare their experience to help them understand if they're outside the norm. Configuration, make sure it can be configured to meet your specific needs and meet your strategic goals. Scalability, making sure that you've got confidence in the technology scalability. Make sure it meets security standards, encryption technologies, implementation process to ensure your data stays secure, and making sure that it's compliant with all the different types of standards. And then lastly, again, you need to be the backbone of the healthcare expertise to help guide your customers through their questions and help them interpret the results if they don't have that expertise. So you may get that externally, or you may have it in-house, but you definitely need to make sure that these are all the different elements that are part of any account group reporting solution that you might offer. So I'm going to pause there, and I'm going to open up to the moderator for questions.
Great, thank you so much. And at this time, we're going to address some questions that came in during the presentation. And our first question is, can you name one of the top requested analytic reports you receive from clients?
Yeah, I would say that varies, but I can give some examples. I guess one thing I would want to say too that is it's important to, I think I mentioned it earlier, is to funnel it back into the product, right? Working with someone like Renee or people, on your end, or the vendor you're working with. The first question would be, is this truly a one-off? Let's answer the client's question, but is there more opportunity across? Is this really something everyone would ask? And one, we can make it a standard for the client themselves to say, okay, they're asking this, do you want this as a one-off or is this a standard? And then also always ask if this should be across the book of business. I use GLP-1, right, because that came up, and now it is our standard, but it wasn't at first, right? It started coming in, and we want to monitor that. We want to act quickly. So I would say new trends that are coming out, when GLP-1 was new, all of that, new analytics, taking a deeper dive into some of those. And then I would also say point solution evaluation, right? There's a lot of money being spent on point solutions. And again, we're bringing in all types of data source for our clients. So, we want to funnel point solution evaluation to any standards we want. And then I would also say there's a consulting opportunity around point solutions when clients are looking for more rigor around it. So one thing we do with clients, in addition to point solution, just in general evaluation, we compare it to market scan. We create a matched cohort and a really kind of a research grade study around that in order to look at the point solution. So depending on the client, again, it really will kind of vary across the board. GLP-1 has never stopped being a hot topic, although we have, our standard dashboards out there. We continue to kind of consult around that. And then I would say point solutions are big as well. And then I guess the last thing we touched a bit about enterprise analytics. Provider profiling in VPC is still, what we're sharing with our clients about what we're doing in VPC, and our account group reporting report to surface providers, right? What are the top providers doing X? I would say that VBC and that provider profiling is key. Again, even beyond account group reporting, when you're looking at enterprise analytics, the nice thing about enterprise analytics, it's going somewhere, right? And Renee talked on that. I'm going to be handing something off to a care manager. I'm handing off something provider profiling. I need to show my account I'm taking action on that. So again, it's a little bit of it does vary by client. Again, the key would be funnel it back to the product if it's applicable to everyone. And then if the foundation is there, there's a lot of consulting opportunities.
Great. Thanks so much, Kevin, and thank you for that question. That seems to be our final question at the moment, speakers, so I'll turn things back to you for any concluding remarks you wish to make.
I just want to appreciate everyone's time. We have our blog here, more details on working with clients and elevating client relationships. So any information you're looking for, we really appreciate everyone's time, and hopefully you're having successful journeys with your account group reporting, and you were able to learn some new insights today with this session. So I appreciate everyone's time.
And to our speakers, thank you for that great presentation and for sharing your thoughts. Thank you to the audience for participating in today's webinar. This concludes today's presentation. Thank you again and enjoy the rest of your day.